to Wana Prana Continuing Education. Thank you so much for joining me, and I'm so happy that you have enrolled in one of my classes. Today, we will be focusing on face reflexology. We'll be focusing on its benefits. We will go over the face map that has all the reflex points. I will go over exit and entry points. I'll go over entry and exit points. We will go over the greeting of the head, occipital holds, shelf and cradle, jaw hip release, shoulder release, thorax trunk release, shelf, mirror, mandible release, spinal release, and coccyx release. Today's class, when you are done, you will be able to incorporate these points into your session, or you can do a closed session and just do an actual hour focusing on the points, doing a very slow breathing session. Face reflexology can be a closed session, or you can incorporate it into your session that you are already doing. Incorporating these points will cause greater relief through the whole body, and as I show you the entry and exit points, and you see the flow of the 12 invisible meridians that run through the whole body, you will understand how the opening points in the body, how releasing them is going to give a greater effect of relief and longer lasting for all of your clients. Thank you again so much for enrolling, and let us begin. Let's go over the face map. We're going to start with 1, the thyroid gland, right at the notch on the clavicle. Then we're going to go to the chin. 2, the bowels, constipation, dull skin. 3, pancreas, right under the lip on each side. 15 is the sex glands on each side next to the pancreas. 4, on each side of the mouth is the lungs. It's good for skin. 13, right above your lips, between the nose, on spleen. 6, the tip of the spine. The tip of the nose is the spine, also the stomach. 7, lymphatic and liver. It's the deepest part of the jaw. And then as you follow up, the zygomatic arch. 8, the digestive process. 9 is face, skin, and colon. It's medial under the eye. 10 is the kidneys. And remember, we're going to tap gently in these spots. 11 is pituitary gland, which is good for reproductive system. It helps with the memory, perception, imagination. 12 is mental alertness. And then the ears is for every gland. 14. 13 is for the nervous system, the center points of the forehead. Now we are going to look at the entry points, which are all yang. They stem from heaven and move down to earth. We have the B1, the bladder point. It's on the inner, the medial point of the eye, the orbit. Okay, so I want you to take notice of how it flows up the head. And then it goes around the back of the head
down the neck. And it's going to split going down the spine in 2 channels. So imagine if this point is not having any flow, it goes all the way down the leg, how it's affecting the whole body. This helps with panic and fear. This is our fight or flight response, all eye problems and frontal headaches. You can see how that would cause a lot of pressure in the whole body if this meridian isn't flowing. It helps with insomnia, nasal congestion, and it also helps with the whole autonomic nerves. And as you can see, since it's running down the spine and all our spine bundles are in the nerve, in the spine, of course, it's going to help increase the flow. Now we have the gallbladder. The gallbladder point, the outer orbital, the hollow of the eye. And this is the lateral. And now watch how this one wraps around the ear. Goes around the whole head. Sorry, I didn't mean to light that up. And this helps with body flexibility, also headaches, people that get them on the side. I feel like when we're thinking a lot, this helps with release pressure in the temples. It helps with dizziness. If our eyes are over tearing or we have itchy eyes or blurry vision, this is a great spot. It's also goes all the way down our body and kind of wraps and then goes all along. It's interesting. See how it goes down your IT band? So flexibility, body flexibility, also flexibility in life. When new things are coming at us, moving with them, the saying, dancing in the rain, going through the storm. So this also helps with discernment, and I just want you to see how all these points run through the whole body. So when their flow is impacted, the circulation to the organs, the whole body is affected. So by opening the points on the face, it really helps to stimulate. I also feel it's very important to pull on all the fingers and toes. One of the first things I do when I come into a session is I greet and I hold the people's feet for a few minutes, pull on their toes, and then I kind of roll compress at all their joints. So there's the gallbladder, which is very close to the triple warmer. Next, we have the stomach point. A lot of people carry their worries, their fears here. So it's directly below the pupil at the orbital ridge. And this has to do with the root of life and birth. And this is the longest meridian in the body. It helps us to assimilate life. So if we're worried and we're always in fear, or how are we digesting the world around us? Is it nourished? Are we nourished by the world? Or are we in worry constantly, creating anxiety and panic? So this one also, it's going to go down the face, around the mandible, then go back up the head, and then it goes down the front of the body. Also, this helps with, so obviously if your mind is stressed because you're worrying all the time, so we want to go into a more positive mindset. Helps with night blindness, facial polaris, sorry, I can't pronounce that right now, teary eyes. So, as it goes down the neck, along the clavicle, and then down the front of the body. And then watch how it moves all the way down. See how that lit up right there, that point. That is a point in the body that I would always go, and a lot of people, it feels like it's completely drained and needs to be replenished. Working along the lower leg really helps the body, stimulating the stomach meridian. It helps get the flow going. So paying attention to these 3 points will just help to give greater relief, especially for headache patients. So now we have the exit points in the body, which are also yang. So they are heaven moving down to earth. And we have the triple warmer point. See how close it is to the gallbladder, 23. It's in the depression of the lateral edge of the eyebrow. And this helps with cooling down the whole body. Watch how it wraps around the ear and goes down the neck. It's going to help the body if the body's overheating, or if the body is too cool, and some people run cool and they don't have enough circulation running through them. So this is also, if you ever hear about the chambers, the upper, lower, and mid chamber in the body, these are the 3 origins of the water. This helps to move liquid. It helps with upper jaw, toothache, dizziness, tremors of the eyelid, blurred vision, epilepsy. And then this one is going to, the channel goes out our fingers. So this is why it's very important to pull on the fingers and toes, because most of the meridians, I'm sorry, I'm having a hard time getting this so that you can see how it comes out the top of the ring finger, because some of the channels will go underneath the fingers on the palm of the side of the hand. This is going to be anterior, and then it moves along the whole back of the arm. So moving along this, if you're doing a full session, hitting on some of these points will release a lot of pressure, especially if someone's angry. I feel like this helps. Oh, menopause. Oh, I've had so many women, as soon as I hit this point, I can feel their whole body completely cool down. People that are going in menopause, a great point. Okay, so now we have the small intestine. The small intestine is located at the depression of the mouth, the condoid process of the mandible. This helps with mental clarity, brain fog, helps to sort out the brain. So if we're having a lot of inflammation, arthritis, bacteria, having a hard time hearing, helps with deafness, then we are going to work along and watch how the small intestine wraps around onto the scapula. There's very important points on the scapula, and as releasing these points really helps to going into the joints and along the pinky. Helps release a lot of inflammation, arthritis. It really helps our joints a lot at this point. So I feel it's very important. See how it just wraps around the whole scapula and then into the face. front of the neck, the ear. And now we have the large intestine. The large intestine is going to wrap from the left over to the right. I'm sorry. And this is located in the border of the nasal labial groove. It helps to transport the waste and letting go. It opens the nasal passage, congestion, reduces nose bleeds, clears discharge, facial paralysis, itching and swelling of the body. And it's going to as well move down. So all the exit points, as you can see, are within the upper portion of the body. There. It wraps around the mouth. And it moves down the front of the neck. Wraps around the back of the shoulder, the scapula. These are some headache points. If you are giving your client a full body, these are some great points to hit on to help give greater relief, encouraging greater flow through the body. You can tap on these points or just ask your client to take a deep breath and hold the points lightly for a few moments. Let's begin with greeting of the head. A lot of people like to start with a solar plex hold, but I like to greet the head first. And then if you'd like to go into the solar plex hold, first I put my thumbs on the forehead, right at the pituitary point, with my hands on the side of their head, with a light effleurage with my thumbs. This is just going to calm the nervous system. I'm moving my thumbs in an effleurage, moving my hands in a light lateral movement, effleuraging the forehead. This is going to help with congestion, calm the nervous system, and holding the pituitary point. The pituitary point helps with pituitary gland, the liver, metal, toxins, the way people see the world. So I think mental illness, that and the thymus, hypothalamus. So I'm just going to effleurage. And then remember, while working on the face, we want to be gentle. Slow, gentle movements. We don't want to do any sharp, fast. So now, ask your client to take 3 deep breaths. And you're going to hold the pituitary point. And as they breathe, you're going to press in. And as they breathe out, you're just going to hold the point. This is a gentle feathering with the fingertips, bringing further relaxation to your client. Again, let's take notice at all the muscles on the occipital ridge. So I feel like, and how they wrap along the mandible. So this is a very important area to release. We get a lot of pulling. People that are getting headaches hold a lot of tension. And because the mandible holds our hips, so a lot of people feel the tension from their hips in that area. So I like to just kind of knead the shoulders, squeeze them, just relax the area a little bit. If you want, you can just kind of work the upper traps with your fingertips, do some circles. And now we're going to I'm going to show you the occipital hold. Here's a great place to offer your client some aromatherapy so they can take a deeper breath and engage with you in the breathing process. Encouraging deeper relaxation for your client. We're going to place the fingers along the occipital ridge. Remember, we're using our fingertips. And we're going to ask the client to take a deep breath as you let your fingertips relax along the occipital ridge. So as these muscles relax, your fingers will kind of start sinking into the bone, the occipital, deeper and deeper. So we're just going to hold this for a few minutes until you feel the muscles soften and kind of give. So we're going to keep our fingertips steady, still, along the occipital ridge, moving them back and forth in a scissor motion, but we're not going to lift your fingertip. You're going to keep it on the occipital ridge and just move back and forth, gliding along the semispinatus capillaris, just moving medial to lateral. And then we're going to repeat this 3 times. So you're just going to keep your fingertips back and forth. And you can count 1, 2, 3, 4, 5, 6, 7. And then move along the ridge, sliding up a little bit. Again, 1, 2, 3, 4, 5, 6, 7. Then slide up the ridge a little more. 1, 2, 3, 4, 5, 6, 7. And just remember, when you're making the scissor motion, your fingertips are still. And then you're going to repeat on the other side. You see how my fingertips aren't moving? I'm moving muscle with my fingertips. But as I'm doing that back and forth motion, my fingertips are locked on the skin at one point. Now we're going to bring the neck into a stretch. We're going to stretch both sides, holding for the count of 3. Make sure you're gentle, you're working with their neck. Don't push it past their point of range of motion. And then this is going to gently transition us into the shelf and cradle. Gently turn your client's head to the side and give them a gentle stretch. And just hold the stretch for a few moments. Ask your client to take a deep breath as you stretch and hold the stretch. Hold it and just feel the muscle, the belly of the muscle kind of start to relax. Make sure you remember to stretch the other side. Always do what you do to one side, to the opposite side, left and right. For the shelf and cradle, you want to ask your client to turn their head in the opposite direction that you are working. This will help to relax the muscles along the anterior neck. So again, because we're working the anterior neck, we want to be gentle and make sure they don't have any pacemakers or heart conditions, stroke. So we are going to be gentle, hold the point, ask your clients to breathe. I usually use one finger, and you can see my thumb kind of rest on the the inner clavicle. And sometimes I kind of move my fingers in a circular motion and do one side, and then make sure you always do the other side. This is going to help the thyroid gland. So I'm doing like a gentle effleurage with my finger tips. Please use very light pressure in this area. So sometimes when things feel like a knot, you can do a gentle rocking back and forth with your fingertips. Do a little circle. You have a lot of muscles attaching. You have your subclavicular, your deltoid muscles, traps. Using my thumb, effleurage. So while we're working this area along the clavicle, and make sure you repeat this. We're going to do it 3 times on each side. So we're going to effleurage 3 times, gently using our fingertips. My thumb is gliding on the clavicle, inner clavicle, gently. the jaw and hip release. We're going to start medial with our thumb along the chin and our fingers under the chin on the submandibular muscles. And then we're going to effleurage our thumb along the mandible, medial to lateral 3 times. This helps the colon. It's good for constipation, helps with the pancreas, regulating hormone imbalances. People that get cysts, this is going to help with the lymphatic, the toxicities that we get from the environment. It's going to help to release. Now when we hold in the corner, going to the lung points. Right now I'm working in the jaw. And this is going to hold for a few seconds. And we're waiting to feel the muscle to start to release. And it slowly pushes my thumb, or my fingertips, I'm sorry. And there. So watch my thumb as I move down. I hold the spot, asking the client to take a deep breath. And as the spot releases, you'll start to notice my thumb gliding down. Also notice their lips. If they have poor circulation, they may be very pale. Sometimes they just lack vitamin B, iron. And then lips that are really red, they may have a lot of acidity in their stomach. If their lips are really dry, if they're not drinking enough water, dehydrated, that's when we get sick. Repeat this 3 times. Sometimes I like to brace my head on the top of their forehead as I use 2 fingers to effleurage by the ear and just push down, effleuraging. So it's a very relaxing hold. Let your thumbs, as your fingers move down, glide down the forehead. Just allows deeper relaxation. You have a lot of points right around the ear. Remember we had that triple warmer. If they get headaches and their jaw is really tight, you can ask your client to turn their head to the side using your thumb and just continue to effleurage down. Next is the shoulder release. Along the eyebrow line, there are 3 main points. We have the kidney points, the adrenals, and then if we move under the eye, right under the pupil, is the stomach. If you start medial and move lateral with your thumb effleuraging lightly, while your finger is gently along the inner ridge. If this is comfortable to the client, if it's not, then just use the thumb to effleurage on the top of the eyebrow. I like to use my pointer finger and my thumb along the superior orbital foramen. And you will feel your fingers start to glide as the points melt under your fingertips. And we are going to move medial to lateral 3 times. Holding our thumb and pointer finger. And as the muscles and the points under our fingertips melt, letting them glide as along the eyebrow, gently. The shelf and mirror, we're going to start at the orbital ridge, moving lateral along the occipital socket, effleuraging 3 times while I have my thumbs along the eyebrows. We're going to go light, moving the pointer finger along the zygomatic arch. You're going to pass over points 7 and 8, so we're hitting that stomach point. This is a very important point. It helps with a lot of stress, overthinking. People aren't getting enough sleep. People are adrenals if they're holding too much water. And now I'm going a little bit closer to the orbital ridge. See how I'm moving lateral along the occipital socket. And I'm gently effleuraging down. The cheeks are great for respiratory, the circulatory system, the energy that we bring into the world and how we share it. So I want you to ask your client to take a few deep breaths. Just hold the solar plexus. See how my finger's right there at the cheek. Hold right there. And as it relaxes, your finger glides down A lot of people like to start with the solar plexus points in reflexology. I'm just going to relax her mandible a little bit more because I feel a little bit of tension. So just note that all of these are techniques that you bring into your practice and use them as you feel, in the order you feel. Let your fingertips start to become sensitive to the muscle tissue, the texture. If it's hard, like a little ball, that's a point that we want to hold longer. Heat, coolness, lack of circulation is cold. Heat is inflammation too much. Now we're going to move to the mandible. The mandible also mirrors our hip and pelvic region. It is the sacral, where we hold our emotions and our truths. It helps with mental alertness if we have a lack of focus or our mind isn't clear. So it's going to help us to calm our mind. So what we want to do is hold our thumbs along the top of our head. And then I'm going to place my pointer finger. My middle fingers are going to hold at her temples. And then I'm going to ask the client to take 3 deep breaths. You can breathe with your client if you need to help engage. Sometimes while I'm working on a client, instead of asking him to breathe all the time, I will just start to take a deep breath, not in a creepy way, but just to let them know. And I will tell them right before a session, if they hear me take a deep breath, that is my way of engaging them and asking them to take a deep breath. And finally, the spinal release. We're going to start at the nasal inferior, and we're going to, using our pointer finger effleurage down toward the ethmoid ridge of the nose. The nose is the hologram of the spine. So with a finger on each side of the nose, we're going to move back and forth gently with a steady pressure of our fingertips. And we're going to move inferior. And then we're going to repeat this 3 times. Now, right here, I feel an area that's a little tighter. So I'm just going to spend a little bit more time in effleurage. Or I may use my finger to do a few circles. And just hold the point. Have the client breathe and continue to hold the point. Repeat this 3 times, moving down the nose towards the ridge of the nose.
For the coccyx release, you're going to put your finger at the tip of the nose and hold your finger, and this is, you can gently lift the ethmoid bone with your finger. It's like lifting the inner spine, releasing the vertical holding patterns that we hold. Note, broken capillaries in the nose exceed hot liquids, coffee, tea, alcohol. Again, thank you so much for joining me today. I've enjoyed instructing you in face reflexology, and if you haven't already, please go take a look at my other reflexology classes. I think you will enjoy them as well. Thank you again.